Okay, like this, you can share the screen. You can see it.
We can see that.
Okay, perfect. Very good. Thank you very much. So, good morning to everyone. I'm Enrico Dolza, and I'm the director of a foundation which is located in Italy, northwest part of Italy, near the French border, and we are in Torino. And we are a former institution for the deaf, which means that we formerly have been basically a residential school for the deaf. But then during the last 40 years, the institution started to work with deaf people along the whole life cycle. So now we take care of deaf from the very beginning of their life, from their birth, and because now diagnosis is very, very early, until also senior age, and we have some housing facilities also for deaf seniors. And we are very proud to be involved in a project which is designing, which is a project studying the relation between deafness and dementia and Alzheimer. It's something very new for us, but it's also something we really need to discover and to study for ourselves and for our. What we did in this project, which is funded by Erasmus Plus program from the National Agency of Germany, has been a survey to understand which are the barriers for deaf people about health services. In the background, we have the United Nations Convention for the Rights of People with Disabilities, which is a very important act. We can say law, which design a new idea about what is disability, because in the past century, disability mainly was something related to impairment. So people was disabled because it was impaired. But now with the United Nations Convention, the idea of what disability is has switched more from the medical model to a social model. And in this new framework, disability, including deafness, is not that much the hearing loss, but is something related to barriers that are in the environment. So now, with the United Nations Convention, we think that the disability is not something related that much to a physical impairment, but it's something related more to how is the environment designed. And so also our interview and our research about what deaf people face as barriers in the society is seen in terms of barriers, not that much in terms of their hearing loss. The convention is focusing on self-determination, people with disabilities, and non-discrimination, and of course, accessibility. So these three keywords are also the keywords that were in the background of our small research. We had non-directive interviews directed done in sign language. This means that the target group were deaf, but also but also Nicola, you can see here, my colleague is deaf. So direct interview in sign language. We collected 18 interviews, mainly men, but yes, 60% men and 40% women, of all age range, so from 20 to 60. And we tried also to collect interviews from the whole country. even if, of course, there are some more interviews in the north. That's because we are in the north, but also because maybe you know, but in Italy, population is mainly in the north part of the country. We asked some basic questions in sign language to our deaf target group. The first one is this one: what are the most important difficulties you face when you go to a doctor or in an hospital? We can now explore the answers. The first one is, the first issue is related to accessibility to information and communication. So the deaf people think that doctors lack of sensitivity about the deaf community. They don't know nothing about what it means to be deaf, except to have a hearing loss. They face problem with the quality and the quantity of sign language interpreting services. In our country, hospitals, they should provide sign language interpreting, and they do. But these services, maybe there are some delay in the implementation, and sometimes interpreters are not of very high quality, and they face general issues in communication with doctors. There is also a second issue, which is more related to technological accessibility. When they go to hospital, they don't find assistive technologies, and sometimes they face huge barriers when it's the time to book a visit or examination. So when they have, there are maybe platforms which are not accessible, or sometimes hospital ask to make a booking by telephone. And they are in the hospital. Often there is no Wi-Fi in the hospital. This is a problem for deaf, because they mainly use video communication tools, universal one, WhatsApp, Telegram. They don't use anything special, but sometimes hospital, they have a bad coverage with the internet, and there is no Wi-Fi. The second question is, what would be the ideal service you would like to have at the doctor or hospital to make you feel more comfortable? And here we can see that they would like to have more accessibility to information and communication. So they would like to have a high quality Italian Sign Language interpreting in every hospital, not to be on demand. Because now, if they go to the hospital for something which happened suddenly, they cannot find any interpreting service, because the interpreter has to be called, and the interpreter, sometimes there are very few sign language interpreter, and so they cannot find anyone. And then it's not clear how to pay it, who is in charge to pay, how much to pay it. So this service is not like they would like to find. They would like to find a better understanding of what is deafness when they face, when they meet doctors and nurses. So they would like to improve the awareness for healthcare professionals. And then we had also this kind of answer, which is a bit different from sign language interpreting, that is to have a cultural or linguistic mediator, which is more related to a specific issue, that is that often we can find also deaf people with low communicative skills in every language. Sometimes you can find, of course, deaf which have a very good spoken and written Italian. Sometimes you can find deaf which are very, very good in sign language, but sometimes you can find someone which is not good either in sign language or neither in Italian. Why? For different reasons, because they are they had not that good literacy pathway in their past, because they are maybe seniors, because they have multiple disabilities. So sometimes they are deaf with intellectual disabilities. It's not that rare. More or less 25% of deaf, they have a double diagnosis. And last but not least, in the last 15, 20 years, we have a lot of migrants are not fluent in sign language, Italian sign language. They are not fluent in Italian. Sometimes they are not fluent in any language. You are in Greece, so I think you know very well this issue, because Greece and Italy, we share a huge waves of migrants coming from the sea. And often there are deaf from sub-Saharan Africa, from other countries, and they don't have any literacy. You don't know how to speak with them because they don't have a proper language. So in that case, you don't need a sign language interpreter, but you need more a mediation. And in that case, cultural and linguistic mediation should be done by a deaf, while sign language interpreting is a hearing person, is a hearing professional. In that case, it's a deaf professional that should be involved. And again, to have at the desk, at the receptionist, at the welcoming area, some deaf operators, some deaf workers in every hospital. Second question is technological accessibility. They would like to have remote video interpreting in every hospital. This, with modern technologies, this is not that difficult to have a remote relay service. It should be done, and it could be also cheap, for sure cheaper than to have a sign language interpreter in every hospital physically. They would like to have accessibility in every real-time public event. Often hospitals and healthcare institutions, they implement also cultural and awareness events about how to prevent disease, how to prevent about health, about food. So in that case, all that this kind of event should be accessible. To have a speech recognition in the laptop or personal computers in the desk, or to have a mobile phone at the disposal of the workers, and to make a reservation and booking of visits, and also in online platforms, 24 hours per day, not with this difficult system with voice call. So, coming back to the United Nations Convention, we have to remember that the government which signed this document, and Italy and Greece, and of course Germany and other, I think all the European countries signed this convention, make compulsory accessibility. So we should be aware that our government is not free to decide, I would like to be accessible. No, they must be accessible, because we all signed the convention. So the convention now is a law in our countries. And so all this should be a must, shouldn't be something like, okay, I'm so kind with deaf that I will offer you something. No, it should be something very, very mandatory in our countries. What? So summarizing, accessibility in the web facilities related to hospitals and healthcare in general, and with a focus on universal design. So since we cannot know in advance the communication skills of deaf people, we should be open to everything. We should be open to a writing system. So every communication should be written, and it should be written in a way which is accessible. So not that much bureaucratic, not that much difficult. It should be plain and easy writing system. You should add sign language. You should add also the voice, because there are deaf which are also just hard of hearing, or there are someone which use cochlear implant. So for them, maybe also voice is important, and video finally. So we are in this framework. Maybe some of you would recognize the idea of universal design for learning and of multiple means of communication and understanding. So writing, signing, voice, and images. If we use a wide range of systems, we are more sure that our client will understand something of our communication. And one good way also to promote this kind of universal design for learning is to use video relay service and video remote interpreting, as I told before. And here we are just offering you a very, very short overview of some services we have in Italy about that are accessible, and they are very good, even if they are not completely widespread in the whole country, and they are not completely free sometimes. We have this Communicants, that is an app which is paid by local government in some regions of Italy, and which offer a chat system and also video interpreting by distance. We have Pedius, which is an app which transforms what you write into voice and on the contrary, but this is a private company and you should pay for that. While the first one, it's free, but you have some limit in the use. And the last one is Visit, which is again remote video interpreting, and they also use their services in different settings, not only for healthcare and hospitals, but also in cultural places. The problem is that is to be paid, and there are also some time restrictions. So thank you, and I hope in this very short presentation to have in some way increased the awareness about the communication needs of the people. And thank you to the organizer and for inviting me.